One of the kind of really significant topics, issues that we look at in the healing from relational trauma and single incident trauma is this question of, clinical depression versus grief. And so I'm just going to spend a few minutes talking about that a bit. And, the first thing that I will say is that there is absolutely a difference between grief and clinical depression, okay? And, what are some of those differences? Well, when we're looking at clinical depression, some people are looking at the Diagnostic and Statistical Manual of Mental Disorders, and they are looking at the criteria. If we're making a formal diagnosis of clinical depression, major depression, mild, moderate, severe, we're looking at that criteria in the DSM, and we're kind of making sure that the person meets, the number of symptoms they need to have to meet this criteria over the period of time that the DSM, tells us that they need to meet in order to have this criteria met. Don't have the DSM in front of me, don't have it handy today. But what I will tell you is, some of the things that we're looking at is lethargy, low energy, really significant lethargy, low energy, difficulty sleeping over a period of time. We're looking at difficulty maintaining an appetite. We're looking at some pretty dark thoughts that are pretty persistent, meaning kind of suicidal thoughts. We are looking at, if somebody is not able to maintain their job, if they're not able to function, they're not able to engage in hygiene activities every day, showering, bathing, meeting their daily responsibilities. Okay, that's kind of where we're looking at the clinical depression kind of category for somebody. And clinical depression is very real. Medications are absolutely appropriate in some circumstances. The folks who can really assess for that are people who've had formal training in that. So you're looking at psychiatrists, you're looking at primary care doctors are trained to do that. You're looking at nurse practitioners, physician's assistants. These are all the folks who are trained to formally, assess and then treat as appropriate. A treatment for that might be something like a selective serotonin reuptake inhibitor, looking at Prozac, Lexapro. You're looking at medications like Wellbutrin, Effexor. Every person is different. Their history is different. Every person needs to be assessed on an individual basis by a provider who has appropriate training in that. Okay, so that's clinical depression, right? And I find that we are often in the healing from relational trauma and single incident trauma, we're looking, especially with relational trauma, which is really what I'm going to zone in on. We are looking more at we're looking more at the grief. We're looking more at the realization, when somebody comes into treatment for relational trauma, whether they know that's what they have or not, and they start to really look at their childhood and their adolescence in a very honest, objective light, without a lot of the filters that we've used for a long time to kind of survive that. When we look at the reality of what our experience was like from an unfiltered lens, usually with the help of a trained professional, it can be incredibly jarring, to say the least. And so a lot of times what folks will experience is just a significant feeling of grief and loss, okay? Because what we start to understand, or what we start to see, is all that we have lost as a result of the relational trauma that we've experienced. And that can look like a lot of different things, but for many of us, it's this realization that, oh my gosh, at the age of 40 or the age of 50 or the age of 60, I'm realizing that what the life that I have developed is really not what I had wanted for myself. It's not what I had imagined. This life that I'm living is a life that was built by somebody else. It was built, because I wanted to, because I was taught that who I was and what I wanted wasn't okay. A lot of us realize that the life that we built is really what our parents, told us that we had to do. That it was what was pleasing to our parents, and so we kind of just went on autopilot and did what we believed we had to do in order to be in favor with our parents or our attachment figures. The career that we chose was really not one that we wanted. It was what was going to be pleasing to our attachment figures. For some people, it's like a really difficult reality that, oh my gosh, I really didn't want to have children. I did that because I was taught that was what I had to do because of what my parents told me, or because of the religious institutions that my parents were a part of. That's what they said I had to do. That's what the purpose of marriage was to procreate. And so for many people, it's just this realization of, oh my gosh, this is like this is not who I am. This life that I've built is not mine. It's somebody else's. And so it can be really, really jarring to kind of start to understand that in a different way. I would say the other piece of this is this reality that, like, many of our personality characteristics, many of the things that we've developed over time, kind of the personas that we develop, the masks that we develop, is, we start to, as we kind of go through our healing process, we realize those things like that doesn't feel genuine or authentic to us anymore. And so there can be some real grief and loss associated with that. Like, oh my gosh, this personality that I developed over time, like this is not mine. Who am I? Who am I? And that's a key question in the recovery process from relational trauma, is this question of, okay, so I've realized all this. I'm looking at it very objectively. I've done a lot of the trauma work, whether that's EMDR, that's somatic experiencing, some of the IFS parts work. I've done a lot of this kind of rewiring of my brain that I need to do. And so we look around and we kind of see the wreckage, and it can be incredibly jarring. And it can be like we've lost somebody who we loved dearly. It's like, it can be like losing a limb. It's hard to explain, but if you've gone through it, it's, again, this is where that phrase, the dark night of the soul, that Carl Jung kind of coined so long ago, like that's where this really comes into play here, is that dark night of the soul, this realizing everything's been dismantled. Oh my gosh, I see things clearly. And I feel like someone I love has died. And it can look just like intense periods of crying and sadness and, wanting to be alone, wanting to isolate a bit or a lot. It can be, it can just look like a lot of different things, and it can go on for a period of time. Genuinely. And so that's really kind of the role of the therapist in here, is to kind of, keep a close eye on this, and hopefully by this point we're so attuned with the person that we're working with, is like, we know when this is grief and loss, which is appropriate to the process. Like it's absolutely a necessary and vital component of the recovery process from trauma, is allowing somebody to kind of navigate this period of grief and loss. This has to happen in order to come out on the other side. Okay, and on the other side of this is beauty, and it's kind of starting over in many ways. It's individuation. It's figuring out who we are and what we want now for the second part of our life. Okay, and kind of in order to get to that place, we've got to go through this really dark period of time, and just understand and trust that if we allow ourselves to stay in that grief, there is tremendous growth on the other side. And there's a lot of answers to unanswered questions on the other side too. And so, some of the things that I recommend for folks who are going through this kind of really dark period of grief and loss and the dark night of the soul is, be working with a therapist. Just be checking in with them on a regular basis. Consider working with a body worker. Consider working with a massage therapist or an acupuncturist or somebody who is trained in yoga, who can really help you to move a lot of this grief and sadness through the body through specific movements. Using our creative brain during this part of the process, during this grief period, it can be incredibly helpful. So doing things that maybe we haven't done in a long time or have never done, that use just different parts of our brain that are more flexible, that are more creative. So drawing, it can be crochet, it could be needlepoint, it could be painting, it could be ceramics, doing things that are just kind of just what we haven't done, listening to a lot of music, engaging in things that you just haven't done, being curious about that. Things that use more of the creative part of our brain can be really, really helpful. During this period of time, a lot of people are not going to feel like they want to be super social. And I would say that's okay. I think so often we push people, just do it, push through it if you're not feeling it. And really the purpose to this kind of isolation right now during this period of time is like, we have to be looking inward. And oftentimes, when we're in groups of people, we're absorbing so much energy from those that we're with. And we're so focused on the other people that we're with that it takes away from our ability to really be with ourselves, which is really what needs to happen during this period of time. So that's a pretty big topic. I hope it was helpful. There are a lot of resources that are available. Going to drop some of those in the comment section here. Thanks for coming on here. Thanks for being curious, being willing to kind of grow and expand on this. I hope this was useful to you.